Good morning, everyone. I hope you had a great weekend. It's Easter Sunday, so I know I had a good day with the family going to church and having some lunch after church. So we are diving back into compliance training, and this is for the 99203 new patient detailed code. And this is the medical decision-making component of that. So we've already covered the history taking and the examination component. And I thought this was the most confusing of the three in order to determine whether or not you meet the low complexity medical decision making criteria. So that's what we're going to discuss today. Of course, this is me here, Robert Barton with Workforce U. And the overview again is that we had detailed history, detailed examination, and medical decision making of a low complexity are the components to make up a 99203 detailed new patient exam. And these components need to be present in the documentation in order to qualify for billing the 99203 code. So a compliance program would involve any one of the staff members auditing records to make sure that these components are included in a new patient initial report or documentation. And if they're not included, then you should bring this to the attention of the doctor or your superiors. That's a component of a compliance program. So medical decision making of low complexity requires 2 out of the 3 of these elements. You got problem points, data points, and the risk factor. So only 2. So of course you see that we need 2 points out of the problem, 2 points out of the data, which I'm going to show you here in a second, and then risk that's determined to be low, which I'll show you a table on that as well. So for the problem points, here are our choices. We could have established problem, stable or improving. That would garner 1 point. We could have a self-limited or minor problem, maximum of 2. So we could have 2 self-limited problems, and that would give us 2 points, which would satisfy the problem points just right there. We could have established problem that is worsening. That would give us 2 points. We could have a new problem with no additional workup planned, and that would be 1 complaint, which would give us 3 points, and that would satisfy us. Or we could have a new problem with additional workup planned, which would give us 4 points, and that's more than enough to satisfy the problem points component of the 3 components necessary to establish medical decision making of low complexity. Now for the data points, we need 2 of the following. And any of the following can be performed to equal the 2. And you can see 2 of them actually are worth 2 points in and of themselves. So if you're a medical provider, then these are pretty easy to get. If you're a chiropractor, you would have to review a radiology test, you could possibly discuss the test with the performing physician, which doesn't happen too often. We could decide to obtain old medical records in addition to review or order a radiology test. And of course, we could review or order clinical lab tests as well. For me in my office, I would typically review or order radiology tests or decide to obtain old records. And then we could review and make a summary of the old records, which would have to be documented in the note. So this component, these data points, are something that I would typically not try to achieve. I would move on to the risk. And you only need 1 of these to satisfy the risk component. So low risk only requires 1 of these elements in any of the 3 categories listed. So we have presenting problem, diagnostic procedures, and management options selected. So for presenting problems, we have 2 or more self-limiting minor problems. For chiropractors, this is going to be the problem that is most relevant for us. For medical providers, it could be any of the 3. Under diagnostic procedures, we typically would not perform any of these as chiropractors. Of course, medical providers definitely could provide any in all of these. And then under management options, we have, of course, you can see over-the-counter drugs, minor surgery with no identified risk factors, physical therapy, occupational therapy, and IV fluids without additives. So we would fall under the physical therapy, even though we're not physical therapists, but as chiropractors, we're managing the condition with a therapy or conservative treatment modality, which is what physical therapy would be considered. And of course, we could also manage it with over-the-counter medication as chiropractors if you thought that was appropriate. So again, we only need one of these in order to satisfy the requirement for risk, and specifically low risk. So in summary, we need 2 out of the 3 of these. We either need 2 problem points, 2 data points, or a low risk factor in order to satisfy medical decision making of low complexity requirement. So again, go back through your records from time to time and analyze them and make sure that you have a history which is detailed, and go back and look at those requirements. You have an examination which is considered detailed, and again go back to the previous video and look at those requirements. And then medical decision making of low complexity. And you put all these 3 together and we have Success 99203 detailed new patient evaluation and management code. Now what's important is that you or anyone in the office, as a part of the compliance program, analyzes the initial reports that are billed with this particular code to make sure in an audit, your own audit, that you satisfy the requirements. That way, if a regulatory agency ever came in and they wanted to examine your records would stand up, or at least you can show that you have made an attempt to audit the records and to bring them up to the necessary requirements. So I hope this has been valuable to you in terms of looking at the 99203 detailed new patient evaluation and management code in detail, because I, for one, found it very useful to dive back in and take a look at this code in detail, and will definitely make some changes in my own office to make sure that we are satisfying the requirements of this code. So with that, thank you, and go out and have a great week. I will talk to you next week. Take care.